Babies with Rett disorder look healthy and make some developmental progress, so careful observation and attention to the parental account is essential to detect the earliest signs. Babies are often unduly placid and quiet. They may show disturbed muscle tone, either holding the body stiff, as here, or with reduced muscle tone, hypotonia, as here. Hand postures may be rather fixed, and the normal spontaneous movements seen in healthy babies from birth are not as fluent as they should be. This baby with Rett was filmed by her parents from birth as part of the family record. Although she was making developmental progress, you may notice the constraints on her activities and some involuntary movements affecting arms, hands, and mouth. Failure to walk independently often leads to the request for medical advice, but more than half these children do walk alone, develop some speech, single words, or even phrases, and may use a cup or spoon at this stage. Dr. Einspieler and Professor Heinz Prechtel, physiologists with extensive experience in the analysis of early infant movement, have analyzed donated early videos to assess the presence and quality of early spontaneous movements in babies with Rett.
What signs would lead you to suspect that there may be Rett disorder in a young infant?
So actually there are very early occurring tongue protrusions lasting for half a minute sometimes. Then there is asymmetric eye opening and closing, both closing and opening in connection with a blink. Then we have already quite a number of stereotypies present in the hand movements, but also in connection with head turning and brief changes in facial expression.
Are these all occurring before 6 months?
They are even occurring in the first 2 months. So certainly very, very early.
This is a summary of their observations. This graph comes from a study by Dr. Bronwyn Burford and colleagues of the Universities of Edinburgh and Glasgow, in which experienced health professionals were shown short clips of video from healthy babies and babies with Rett at the same ages and in the same circumstances. The observers pressed a button, BP, when they saw any behavior suggestive of developmental difficulties. The yellow columns represent numbers of such incidents indicated in Rett babies, and purple columns the normally developing infants. In all cases, comments on babies with Rett were more emphatic than for the others. It is clear that at each period during the first year of life, the babies with Rett raised more concerns than those without. The health workers commented on postures, movements, and appearances of the babies, especially remarking on the hands, even in the first days of life.